Hey friends, this is episode 3 of Own Your Curvy Life podcast. I'm Jan Tannery, owner of Botticelli in Smithfield, Rhode Island, and
I'm Cindy McNeil, assistant manager at Botticelli.
no, you just run the place. I just pay for it. That's where we're at now.
All right.
So today's topic, this is something that's near and dear to our hearts. We've all been affected by it. If you're watching this podcast,
Trigger alerts may happen. I'm sorry.
yeah, if this gets triggery, I'm sorry. Hopefully it won't. Hopefully us sharing our stories will help. But today we want to talk about fat bias in the medical field.
It's big.
It's big. It's really big.
And it's truth. It happens. You have to be an advocate for your own self and know your body, and don't let, even though they have a medical degree, doesn't mean anything. You still know your body.
Yeah. We have talked about this with clients one-on-one for years. I've actually written a little bit about this and had a couple of things published with my experience with fat bias in the medical field, not in a medical journal, relax, like an online. Yeah, no, I'm not that good, but it's an important topic that I think rings true for a lot of us. Most women over the year, and by the way, I did not realize when I opened the store that this would be this sort of catharsis of us sharing our stories with each other, feeling validated when I go, oh yeah, me too. But that's the little pearl and gem that we've been able to take out of what we do and how we do it. There's something about making women feel comfortable in their own skin, but there's also something about validating women or anyone. Like, this isn't just women, but it's interesting. The things that I've read, I was telling Cindy before we tuned in that I went into the National Library of Medicine, and they published a finding after an extensive study about weight bias in the medical field. And it specifically says that the medical field has a tendency, and I'm paraphrasing, to blow off plus size women, also women of color, plus size women of color, when it comes to medical concerns, conditions, pain, inflammation, all of that. I just want to read this little passage. It says, weight bias has been demonstrated among primary care providers, endocrinologists, cardiologists, nurses, dietitians, and medical trainees, including attitudes that patients with obesity are lazy, lack self-control, and willpower. They personally to blame for their weight, non-compliant with treatment, and deserving targets of derogatory humor. Honestly, I'm going to post the link to this study because it's very, very interesting and it's extremely on point. I have to say that as a plus-size woman with rheumatoid arthritis and Crohn's and all the fun things that come with that, the number of times that I was told that I was lazy, I couldn't put the fork down, but also that I was a hypochondriac because of these things that they just did not want to order the test to find out. Like, I'm 50 years old and they're finally ordering a CAT scan of my hips that I have been complaining for the last 12 years that I have crazy arthritis. So these are things that we've all been through. Cindy, I know that you've been through it. We've talked about it a lot. I don't know if you want to tell your story.
You're scrolling through Facebook, and I always check the memories every morning. It's just a thing I do. I like to look back, and especially when I see like the baby photos. But a couple of the days that have come up from 2004, 2008, the posts were like, I'm in so much pain. I hope the doctor can figure this out. Over and over again, they come up of there's no solution to my pain and they can't figure it out. They told me it's nothing. It's just my weight. I have been going through it since I signed up for Facebook, like looking at all the posts. I didn't realize I've complained about pain so much, whether it was my foot, my knees, my hips. It's never this part, it's always the lower extremities. And I've gone to a rheumatologist. I'm waiting to get into a new one. But the one I had is the one who finally said I had fibromyalgia. And I just want to dig a little deeper into it, because like going to a different person, because I've heard wonderful things about that person, of how thorough they are. And I really want to get to the bottom of it, of what I can do, because that doctor didn't want to help me with it. Just told me ice and figure it out. But I've constantly been told, you need to lose weight. You should get into the gym. Losing weight will stop the pain in your feet because it's so much on them. And looking back at my Facebook posts, I wasn't as heavy before I had kids either. So I was complaining before I added all that extra weight on. So it has happened. My PCP previously, all of my doctors have never said any of these things to me. It was me advocating for myself that finally pushed and said, it's not working. It's not working. It's not working. And it's just arthritis. It's just arthritis from standing on your feet doing hair for 30 years.
Right.
And it's more than that.
Right. Right. And so I've never been a small girl. I've been on my feet doing retail since I was 15. I was in retail in the 90s. So we were wearing high heels. Oh yeah, massive shoulder pads, all that kind of stuff. And I was small then. I was like a Missy size 14. And, aside from the stigmatism that was always with me for being a bigger person, anytime I spoke with a professional, because I've always been the kind of person that will dig deep and deep and deep until I get an answer that checks with me mentally. It was just always, we'll lose weight, lose weight, lose weight, lose weight, lose weight. And honest to God, if it were that easy, don't you think I would have done it before? But the interesting part is that I finally got myself a rheumatologist, not the one that I'm seeing now. He's actually a little older. So I expected his response to be like every other doctor I've ever met who said lose weight. And I had seen him for a few years. There really wasn't an awful lot that they could give me other than Tylenol, Celebrex, which with Crohn's turned into like a horrific battle. So I can't take that anymore. And he gave me a medical marijuana card. Now, I will say the medical marijuana and tinctures are very helpful, but I cannot live my life stoned every second of the day, right? And this pain does not let up. And so a couple of years ago, and P.S., he and I have a lot of the same clients. So a lot of our clients are patients of his. And I speak very highly of him, but I still felt like there was more that could be done, but wasn't done. But fast forward or rewind to a couple of years ago when I sat with him and I said, you have never told me to lose weight. And he said, well, here's the funny part. You're not going to be able to lose weight because of all the medications that you take for your Crohn's. You're not going to be able to lose weight. And he said, me telling you to lose weight would be like me telling you need to grow 4 inches taller. You can't. He said, these drugs, it's like a circle, right? So they put you on these drugs for pain. These drugs make you put weight on, and the weight creates more inflammation. And it's just this never-ending cycle.
Yep.
Now, I'm not going to lie. I was both grateful that he said it, but I cried because, I was like, oh, so I'm basically screwed. And he's like, yeah, yep, you are. Fabulous. That's what I want to hear. But at least he was honest with me, right? The number of times I've been to nutritionists, every kind of healthcare professional, my primate, like nobody. could really give me answers as to the pain that I'm in until I had a Crohn's attack. And then my gastroenterologist told me that I had arthritis related to Crohn's. So there's literally nothing I can do about it. It's a hereditary disease. I do what I can to manage it. You know, I mean, both of us, you have fibromyalgia, I have RA. We work every other day, and we've had to set that schedule up because neither of us can work 6 days in a row. And if we do, we got to be like, okay, I'm spacing my Tylenol out from here, there, and everywhere.
And every opportunity we take and sit.
Yeah.
It's tough.
And our experience with clients is the number of women that come in who almost, I don't know about you, but do you find like they try to make excuses as to their weight? And I often look at
they feel guilty.
Guilty, right? They feel guilty that they're plus size. They feel guilty because, like this story or like this study says, they've been told
it's their fault.
It's their fault.
Yep.
And I have said from the get-go, women walk through my door not because they can't put the fork down. They come through our door because they're on medications that either put weight on or menopause, which put weight on. Two things we can do nothing about. So, you know, again, it's that letting women off the hook. Like when you hold their hand and you go, I get it. Same.
Yep.
It's, you know, honestly, I look at some of my girlfriends, they could eat a Mack truck and never gain weight. Well, that's their genetics. I could eat nothing but salad for a month and still put weight on. Genetics, right?
Yep.
There's so much involved that we have no control over, but we're made to feel lazy and slovenly because we're still heavy.
The rheumatologist that I had that told me I had fibromyalgia, which I was grateful to get a diagnosis, wouldn't prescribe any medication because he didn't like one of the meds I was on for my anxiety and depression. And he said, you have to change that. And I'm like, I finally got that where it's working. It's a perfect blend. And when I talked to my doctor about that, said, no, I'm not messing with it. And that's not the reason. So he wanted to blame other stuff of why he wouldn't give me meds.
Yeah. And also I feel like, I mean, every now and again, I catch a doctor when I talk about, so I've gone to a new rheumatologist who I absolutely adore. She is not stopping until I'm satisfied that we have, you know, I can't tell you the number of vials of blood, x-rays, we're going for a CT scan now. Like, yeah, she is not stopping until we figure out what's going on. But she also listens to me, right? So between the two rheumatologists, I interviewed another rheumatologist. Let's stop right here for a second. I interview physicians. And I know someone out there is giggling just like Cindy, but I interview them and I let them know this is an interview. And it's really interesting because, first of all, it takes them completely off guard. Second of all, I say, I am my best, like I know my body better than anybody.
Yep.
And it's funny because other doctors have said to me, wow, you really know your body. Yes, I do.
Yep.
I know my body. I know what's happening, that I have to be a player in my own healthcare.
Yep.
And if you're here to either just push drugs or blow me off, I'm going to challenge you. And it seems like I get a new primary, like, I don't know, every 2 years nowadays because of the medical system in Rhode Island, everyone's leaving. And when I meet with someone for the first time, I will say to them, I have been heavy my whole life. So if that's all you want to talk about, or if that's what you want to blame everything on, then this isn't going to be a good fit between the two of us. I had one doctor, the rheumatologist, it's a man, which, by the way, I feel like I just do better with female doctors anyway. They tend to listen to us a little more. Sorry. But his attitude towards me was my way or the highway. And I was not ready for biologics emotionally at that point. For some reason, I wanted to wait till I was 50 to start a biologic. He was extremely pushy. He was pissy. And he, in his head, knew best about my body. And therefore, I said, thanks, but no thanks. And this is not the only doctor that I've said, I won't be back because this is bullshit. So it's interesting that as time goes on, more doctors are on board with allowing me to be a partner in my healthcare. When I recently went to the rheumatologist, I had told her that I had had the norovirus recently. And that as soon as everything was out of my system, use your imagination, because that was ridiculous. Cindy and I were like completely out of commission for almost 2 weeks.
Luckily, it wasn't at the same time. Like hers was first, then mine happened. So we were able to keep the store open.
Oh my God, it was
But
gross.
we were disinfecting every day, every couple of hours. It was awful.
I have to be honest with you. It's amazing our countertop is still in place because of the amount of like cleaning fluids that we use on a daily basis. Anyway, I had said to her, I said, not for nothing, but when everything was out of my system, I have never felt better in my life. She was like, really? And I've talked to my gastroenterologist, who is a little angel baby. And, he's very willing. He's interesting because he's willing to listen to holistic things.
A lot aren't.
Because a lot of these autoimmune diseases are there's diagnosis, but what works for me isn't going to work for you and vice versa. So he'll even write down, oh, when I had a flare, I did this and it worked out pretty good. And he's like, all right, let's write this down so that the next time you have a flare, we start here, he's good like that. But I had said to both of them, and I said, I even had like a power surge after the norovirus. Like I was wired, like, let's do stuff. My hips felt great. All of my joints felt amazing. And then when I started going back to my regular diet, the pain came back. Now, my gastroenterologist said it could have been that your immune system was preoccupied fighting the virus and left your body alone. And then the rheumatologist looked at me and said, you know what? We can't find anything else. Let's examine this. So she has sent me to one of the best allergists, and I will meet with them this week. And she said, it doesn't hurt to ask the question. And I'm not one to like really get into the Facebook medicine that people post or whatever, but I'm on a new drug. I'm on Skyrizi. It's relatively new. And I belong to a Skyrizi for Crohn's group. And it's interesting because lately a lot of people are starting to say if they take a Claritin, their joints feel better. And I was like, oh my God, I thought I was going nuts. So, these are one of the things that I'm trying to investigate. Is there a better and I've even said, if I take a Benadryl, my joints feel amazing.
Like an allergy would to whatever.
Yeah. So these are the things that, we are now investigating, but I'm not going to stop. And I'm working with a team of people that understand that it's my body, my body, my choice. Wherever we go with medication, I have to be on board with it. End of story. Yeah. But that's not to say that I don't know about you. Actually, I do know about you. But when you've been carrying this kind of weight for as long as we have, right? I mean, they've pushed gastric bypass for the last 20 years. Like, oh, lose weight. Oh, you can't lose weight, gastric bypass. I'm not wild about it for myself. You may be. Queuing you up here.
Funny thing. In August, September, when I went to my endocrinologist, I have struggled just before COVID. I got diagnosed with being a diabetic. My sugar was right around that 6.87. They wanted to put me on metformin. I refused. I was like, And
why did you refuse? Let's talk about that. Because you had what, gastric issues?
I just know people that have been on it that haven't done it, that don't do well on it. Let me put it that way. And so I says, please give me 3 months. And this was just before the shutdown of COVID. And it was in January of what, 2020, 2019, whatever it was.
2020.
2020.
Yep.
I started a routine. I was at the gym 3 days a week. I was doing yoga the other 2. So every other day it was gym, yoga, gym, yoga, gym. And I was managing it. Then the whole shutdown happened and everything just exploded. I had to finally give in. I went on the metformin. I was sick as a dog because he had to stop me somewhere. I called him up crying. I'm like, I can't do this. Like, I can't. You saw me in the shop.
You spent most of the day in the bathroom.
I couldn't, no matter what I did, because I don't have a gallbladder. And it just didn't work for me. So then he tried a different one and it just never worked. Back in the beginning of this September of 2023, my A1 hit the all-time high of 8.5. And he was first doctor. And then I went to my PCP and I had a talk with her. And I said to her, how would I be a candidate because of my heart? I had high blood pressure and now being the 8.5. She says to me, I'm going to send a referral over so you can just stop the process and talk and see if it's right for you. So I started the process back in September. I filled out all the documents for gastric, the sleeve. And in December, as we all know, as you said, you know your body. I have panic attacks that I used to take, Ativan for, and I knew that's not great to live on those. So I started to not take it and really know my body. I can walk myself through a panic attack now. I put music on and I just like walking, distract myself. I can feel my body. I know when my blood pressure's high. Like I really got in tune with it. December 8th, I was at work and I called Jan up and said, I need to leave and I'm going to the hospital. She yelled at me to call the rescue. I wouldn't call the rescue. I just went into the hospital and I had a mini stroke. My blood pressure was it no, my sugar was 254 and my blood pressure was 180 over, I think it was 100 or something. And really scary, very scary for me. And then I had my appointment recently with the gastric. So I have done all the preliminary stuff and this is my journey.
So you're going to go for the sleeve.
I would like the sleeve. They really want the bypass. Like they would prefer the bypass because of all of my other health conditions. The high blood pressure, the diabetes, they really think that the bypass has better outcomes. That wasn't my thought going into it. I think that's a little too much for me, so to speak. I'm not comfortable. I'm not comfortable with it. And so I've done all the preliminary. I have done all the medical stuff I needed to do. My endocrinologist finally listened to me that the pill that he had me on was not working and switched me to the shot. I started taking this shot in February, I think it was January. What am I on? I think I'm on 3 months already, maybe the middle of January.
Yep.
And I switched to the shot. And since then, I have lost 30 pounds. My A1 went down to 6.2. So I have been doing it on my own. I have the bands at home and I sit and do them. And to get to the gym, it's just still, I feel funny. But at least if I'm sitting watching TV, I can do stuff. So I've done it. And I don't know when I go back in May, when I see the bypass doctors, if it's going to happen for me or if it's not going to happen. I don't know, but I'm not going to close that door yet. But if I can, if
I
I can
think
continue
leaving
on
your
this
options
path,
over is smart.
yeah, but it's not out of the question. But it took me a while because going back, my PCP years ago had said, "Oh, I think you should do it," and I was like, "Are you kidding me?" No, it was a no. But now that the
Well,
medical
so
issues,
can we talk about that part of it
yeah,
for a minute? Because we see this a lot. One, diabetes medications, when I first opened, diabetes, they had pills and they had insulin,
yeah,
both of which prevent women or men to lose weight. So
yeah,
you're told to lose weight, right? And raked over the coals if you don't lose weight. But the meds that they gave you to iron out the diabetes
yeah.
made you put weight on.
Insulin is a blocker. It
Right.
blocks you from losing weight. So anytime anyone is on any type of insulin,
Right.
it stops and everything stops you from being able to. But not
So,
once did they ever say, let's check your thyroid. Not one doctor has ever said to me, let's check your thyroid. Not one.
but I mean, we found this from women all the time, right? And then they felt guilty. And then, by the way, doctors are just as rude as strangers
Yep.
when it comes to your weight, right?
But-
Like the number of times that women have come in after a doctor's appointment and they are either rip shit or bawling their eyes out.
Yeah.
Okay.
Yeah.
It's heartbreaking. And you want to look at them and say,
we
know. Yeah. It doesn't make it any easier, but I'm holding your hand and I'm telling you, I get it. Right.
Yeah. But there's a guilt with it. There's a guilt feeling the way we feel. Like when I first came to you and said, this is what I'm thinking of doing because of my health. It was like, I was scared to say it to you because I didn't want, and I've said it to you, I don't want people to think I was taking the easy way out, but I have
cheating.
That I was cheating. I have 4 kids and I have to be here for them. And having that mini stroke,
I need you. Come on.
Scared the crap out of me.
Yeah, that was scary.
Sat on the table crying as they're doing a CT, and I'm like, I just want to see my kids. So
women harbor a lot of guilt. It's interesting the number of people, dear friends of mine, who have opted for surgery, either sleeve or bypass, and who have been afraid to tell me. And first of all, who cares what I think? But second of all, what did I say to you? I've been waiting for you to tell me.
I'm happy you're finally taking control of your body,
right,
and your health. That because I've pushed my health off to the side, taking care of everyone else, and
right,
yeah,
and one, I don't know why anyone cares what I think, but two, I've said this to numerous friends, you included, that if you're losing weight because you think that it's going to solve all of your emotional problems or society problems or mental health problems, or that you're suddenly going to become pretty now, I question that motivation. But you know what? Again, who cares what I think? But if you're doing this to take control of your health and you want to be here for your children and you want to, you know what I mean? You want to live a better life. If that's your choice, I will support you, but I had been waiting for you to come to me. But it's so funny because you're like the third person that was like, I've been afraid to tell you. And I'm like, who cares what I think? But second of all, good for you. Like if this is what's important to you. Now, full disclosure, I too have been in so much pain. I have put on so much weight because of all these medicines for the RA and the Crohn's, that I too went to my doctor and I'm like crying because yes, I can ugly cry at the drop of a hat when it comes to talking about pain and inflammation. And I looked at her, and by the way, she's like this big and this tall. And like when she goes to check my ears, I have to bend over on the table so that she can get to my ears. She's so adorable. But she's very kind. We had the conversation about my weight the first time I met her. She was fine. And I said to her, first of all, diabetes runs in my family, and I was in the pre-diabetic range. And I also knew that everything I had tried up till now was not working. And obviously I don't want to be a diabetic for all the reasons, right? It's not one, it's all the reasons.
Diabetes
So
on top of everything else that you have would
yeah.
really be hard.
Yeah. And so I said to her, this goes against everything I believe in, but if you can't help me lose even 30 pounds, then I'm going to consider this bypass. All kidding aside, when I say weight loss is bad for business, blah, 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 I needed to do it. I was 300 pounds. Yes, I'm very tall, but 300 pounds is still 300 pounds, right? And so we had a very frank conversation, and she said, I'm not a big fan of the surgeries. She goes, I know that I have a lot of colleagues who think that this is the cure-all and everything. Right. She goes, I don't necessarily think it is, but because I was pre-diabetic, we went to the injectable route. And now every time I have an increase in the meds that make me put weight on, we've had to increase the injectable. I've managed to take off 20 pounds. And I'm holding. And I mean, like, after almost a year of being on one, I'm holding. Now, other people have lost 70 pounds, who's lost 120. That's the other thing. You have to stay focused on you, what's best for you, and how you feel, and not compare yourself to everyone else.
Every journey is different.
Exactly. And so I'm on an injectable. I'm doing the best I can. But it's interesting to me that whether or not it's still there, right? Like in the back of your head, it's still there that if I lost weight, this would be fine. Or if I lost weight, this would be fine. I have to take it day by day and do what I can and keep picking away until I find out find a solution, or what the hell is causing the pain and the inflammation, right? Like sometimes people will say to me, oh, sit down. No, if I sit down, I can't get back up. So here we are. You know what I mean? And it's been a challenge. It's, and we all have insecurities, and we all wouldn't. And
you're never going to get that. We have seen women that have lost weight where they're coming for their mother dresses, or they're just shopping because they need new clothes. And you see them struggle because they still see themselves heavier.
So that's actually a syndrome. It's called phantom fat. There was a doctor at Rhode Island Hospital when gastric bypass first came out. It was called phantom fat. And it was that mentally you still see yourself bigger than what you are. So like a client who used to shop with us was a 3-4X. She lost 100 pounds and she was still shopping in the 3Xs. And I was like, what are we doing? But she just didn't equate to her because she'd just always been big.
Yep.
Right.
And they still want to hide.
Yeah.
They hide.
And that, listen, there's so many psychological things. There's so many, one day you can wake up and say, I don't care. I had a girlfriend that was like fat and happy, like whatever. And you know how we feel about that F word, but whatever. But then days you wake up and you're like, I don't want to be this anymore. Right. And I think, listen, we all wake up and look at the grass is always greener on the other side. How many times do women say to us, the mother of the bride or the mother of the groom is like a size 2. She'll have no trouble finding something to wear. And I'm like, well, or they say to us, I don't want to embarrass my son or my daughter by being plus size. Or I know those are the things that break our heart when we hear. Yes. And it hurts because I think somewhere deep down, you might have thought that at some point.
Yeah. Yeah.
I have a sister with a port wine stain on the entire right side of her face. And over the years, she's tried to have it removed. And when my oldest nephew was born, she went to have it removed. And I was like, why? Like, you're beautiful. It doesn't matter. You're married. Like, this is not an issue. And she said to me, because I don't want my children being made fun of for what's on my face. Right? Right.
I didn't bring Kleenex to this. Come on, stop. My God.
Right? Like, these are the things that still rattle around in our heads.
Yeah.
And
last year I said it to you with my oldest graduating, and he had the National Honor Society Awards. He had all the ribbon awards and cords. And what did I say to you? Please just make me look great. I don't want to look like a bum.
Right.
Like, I don't want to look it being so heavy, and it's there. You don't want to do that to your kids.
And our insecurities are always there, popping up at like the weirdest time, shit you don't think of. All of a sudden, it just pops right up at you.
Yep.
And kind of like sucker punches you. So, and then you go to a doctor, and the doctor reinforces
the guilt.
Yeah. So like, I had a client, I've known her for 20 years. Linda is a little angel. She's always had larger arms, smaller torso, bigger legs. We see this a lot. I mean, it could be lymphedema, it could be this, could be that. She had been to the same doctor for years. And Linda came in one day and said that she's gotten a new PCP, and they finally figured out that she actually has a disorder. Don't ask me what the hell it is. I can't remember, because honestly, she just sat there holding my hand, bawling, saying, it wasn't my fault. Like in this big, Goodwill Hunting moment of, it wasn't my fault. And I said to her, of course it wasn't your fault. And she goes, no, it wasn't my fault. And she's like sobbing. And I said, I'm really sorry that for decades you were told this was your fault, because it really wasn't. And I said, I understand, I can relate, and it really sucks. But isn't it liberating now at this point in your life that you can say, wasn't my fault? Right?
Yeah.
The number of times, I mean, I worked, so when I joined Coastal, they had all these specialists that were available, and one was a nutritionist, and I was slowly putting weight on, even though I was on this very restrictive diet. And no, I wasn't cheating, which, by the way, that irritates me, right? So when you meet with a nutritionist or you meet with a doctor and they put you on a plan and then say, oh, you must be cheating, you haven't lost any weight. Not the fact that this doesn't work, or the pills that you were on doesn't work. I kept saying to you, that pill is not working. Yep. Insist that they give you an injectable. Yep. Right?
And he wouldn't.
For a year, he wouldn't give it to you. And
I was on the pill form of the shot. Right.
Doesn't matter, it wasn't working. Right? I was on Ozempic. It didn't work. It wasn't bringing my blood sugar down. Yeah. And then I went to Trulicity, and my blood sugar dropped like that, right? Like, your body's going to respond differently to things.
I was on the highest dose of Rybelsus, 14 milligrams. I'm taking half that with a different injectable. I don't know if I can say it. Can I say it?
Yeah,
Manjaro.
Yeah.
I am on 7.5, and it has done half the dose.
Right.
So it does. Tell the doctors, make them listen to you.
Yeah. And then I was just like, find a new doctor, because this one's not listening to you. Yep. And had you not had that TIA, I'm not sure he would have.
No.
Right? He would have just kept brushing you off, which is annoying as shit.
Yep.
So this young girl worked for me. She was a survivor of bulimia. When she stopped throwing up, she put on like 200 pounds in 2-3 years. Wow. She was in her 20s, right? Newly married, wanted to have a baby, couldn't get pregnant. They were frustrated, and no one bothered to test her thyroid. Everyone just said she had PCOS. She did not have any of the telltale signs, first being the beard. She had none of that. She wasn't sleeping nights. She needed a CPAP machine because, she was holding her breath how many times in the middle of the night. Also, when you have sleep apnea, the cortisol levels go up because your body is so stressed out because it's not getting enough oxygen, right? So that helped her put weight on. Bravo. Yep. And so she finally ends up at a fertility clinic because she's aggravated. She can't get pregnant. And the first thing they do is test her thyroid. And hello, on the way home, she gets a phone call. She's not even home yet, to say that her thyroid levels were triple of where they should have been. They put her on like Synthroid or some, a thyroid medication, and she's pregnant within a year. She starts dropping weight out of nowhere, right? Because her thyroid was off, but it just didn't occur to anyone, right? When they found out that I had a thyroid issue, I had gone through the whole colonoscopy with the Crohn's, all this kind of stuff. And again, my gastroenterologist is an angel, so this is no disparagement on him. But I had said to him, I want to say like in 2017, I said to him, I'm cold all the time. I'm packing weight on and my hair is getting thin. Like there's a lot of fall. And he said to me, well, maybe you're putting weight on because we've handled the Crohn's, that now your body is like absorbing the food the way it should. And that still didn't ring for me. So I went to my primary, and it was funny because the client was a nurse, as a lot of our clients are. And she said to me, she's like, don't back down, keep going. You have a thyroid issue. And I had a functional medicine doctor at the time who I absolutely adored. And I went to him and he tested my thyroid. Well, the interesting part was my thyroid wasn't off the scale. He said, but if you're still having symptoms like a thyroid, like hypothyroidism, we're going to treat it anyway. So apparently there's a range between like 1 and 4, and I think they might have changed it, but like 1 and 4. Well, my thyroid level was at a 4, but naturally for me, my thyroid level should be at like 1.5. So once he treated me for the thyroid medicine, same thing. Right? And so occasionally I'll start with the same symptoms and I'll say to my primary, I think my thyroid is climbing because I'm having all the symptoms again. They'll test me. I'm still within range, but they will up the medicine because I'm having the symptoms. So like, this is the stuff that we have to insist upon. I'm not one for like Google a medical condition because that's a rabbit hole not a lot of people can go down successfully, but there are things like I'm allergic to something.
Yep.
I have to be because
something in some of the foods that they cook with or they process or something. Or
a medicine I'm taking. Like there's got to be something that's doing this. And I'm not going to stop till I friggin' figure it out. Because that's who I am. But, it'd be very easy. I'm not one of these people who think doctors are gods. So, you know what I mean? So there are people out there that's like, well, the doctor said, my father's notorious for saying, well, the doctor gave it to me. That doesn't mean that you still take it. You know what I mean? But there are people who think doctors are gods, and I'm sure that's fine. But if I'm still having a problem and you tell me that there's nothing wrong, no. Then I'm going to find a doctor who's willing to look.
To dive into it and find out.
Right. So like this allergist, when I was referred to, I said, is this going to be someone who's like not going to stop? And by the way, I love asking nurses their opinions on doctors. Like anytime I need a doctor, I find like my nurse friends and find out everything I can. It's almost like cyber stalking a potential boyfriend or something. Like, I want to know, is this the kind of person I'm going to jive with? Are they going to keep going? Are they just going to throw drugs at me and say, take this, you'll be fine? Or I do. Yep. I always go to the nurses all the time. And luckily for us, we have a lot of clients that are nurses.
One of my friends who now is comes into the store, pathologist at one of the hospitals. And I did the same thing. They're sending me to this one. How is this one?
Yes.
Oh, find a different one. Or, oh my God, you're going to love them.
Or I do this, like, is this someone you would want your father to see?
Yep.
You know what I mean? But when I called in to make the appointment, I was talking to one of the medical secretaries who was scheduling me. And I said to her, is this the kind of guy that's going to just keep going until we figure it out? And she goes, oh my God, he's like a dog with a bone. Perfect. I don't even need like a good bedside manner. I just need someone who's not going to take, oh, well, we did some blood work. You look fine. Not fine.
It all comes down to the basic. Learn what your body's telling you.
Yeah. Yeah.
In December, that episode I had in December, I did all the things of what I would do for a panic attack before I like made the call. Like I think I was at work for about an hour and I walked in between the racks and did this. And I'm like trying to calm myself down and it wasn't working.
And shout out to the client who was in the store with you while you were going through this.
She didn't want to leave until
your family arrived.
Yeah.
And then like touched base with me every week for 3 weeks because she was so unnerved.
She was so wonderful.
She felt so bad, you know.
Yep.
I mean, listen, women have to take care of women anyway, and that's kind of our philosophy.
And even when I walked into the hospital, they were like, well, you have anxiety. Is this a panic attack? And I was like, no, this does not feel like a panic attack at all. Like, I know what that feels like.
Yeah. Yeah.
So you really need to hone in on your body.
Yeah. And unfortunately, like the medical field is not as interpersonal as it used to be, right? Like I had the same primary from birth until I was about 30. Right? Like knew my whole family, knew the family histories. Yeah. And that's not the case anymore. I feel like I'm getting a new primary every 2 years.
They're not sticking into the feet. They're not sticking or they move from practice to practice or.
Right. Because now I feel like we're in the business of medicine versus caring or practicing medicine. I know there's a lot of money, like, listen, there's a lot of money involved, but I have actually fallen in love with nurse practitioners. Yes, I still have doctors, but I really like nurse practitioners and PAs. And the interesting part is that I was talking to a client of ours who is a nurse, but she helped write the nurse practitioner program for at PC. Providence College. And she said to me, she goes, nurse practitioners carry more credits than MDs.
Mm-hmm. They put them more through the ringer.
Yeah. And I was like, oh, she's like, so don't be afraid to go to a nurse practitioner. She goes, you need to feel at home with whomever you're talking with, because so many, you know, I mean, you can't call a doctor in the middle of the night like you used to, all those things, right? So you've got to like know what your body's doing, what you can and can't do, all of those things. Mm-hmm. So here's the other thing. There are a lot of people, like some of the older people in my life, that completely lose their minds when they go into a doctor's office. How are you, Mr. January? And he just nods and says, everything's great. Well, not everything's great. So he's still blacking out occasionally. You know what I mean? Like, my husband does it. My mother does it. It's like it's almost like a white coat syndrome that when they get in front of a doctor, they forget why they're there. Right. And then, yeah. So I'm a big fan of like taking notes and like really marking down symptoms. So the next time I go, beep, right. Like those are the things. Now, the Sky Rizzy that I'm on has a Facebook chat room or what we used to call chat rooms. It's a page now. I know. I'm so old. I remember MySpace. Don't get me started. But you know, there's also anecdotal information. Like yesterday, I was scrolling through and someone said, when I take a Claritin, my joint pain goes away. And I was like, oh my God, same. Like, I didn't know that this was a thing, but apparently this is a thing. So at least when I meet with a doctor, I can go, hey, listen, this seems to be like a common thing. I'm on such a new drug. It's only been out 9 months, I think, that we're still learning the things that it will do. So it'll manage the Crohn's, but it's creating more joint pain like the RA. Maybe I don't have RA. You know what I mean? So like, these are all the things that I want to investigate, and no one's going to do it for me. I have to push them.
Yep.
So, but we as plus size people have all been there. We all know how it feels.
Yep.
I mean, I had a woman come in like a couple of weeks ago, and she and her husband both went to the annual for their cardiologist. And the cardiologist ripped her apart for putting weight on. And she said, I want to find a new cardiologist, but no one's taking patients right now. And I left, and I was so irate because he just didn't look at the fact that she has fibromyalgia, didn't look at all the other meds that she was taking, just ripped her a new one. And so then what did that do? It pushed her to want to eat. I mean, I have another friend of mine who was told that she should have gastric bypass by a doctor, and then went to McDonald's and sat in the parking lot and drank a shake and some French fries because she was so depressed. Like, these are things, you know what I mean? Like,
I did it once.
Yeah. You know what I mean? So I think doctors need to kind of take a little more care as to what they're doing and how they're doing it. I'm sure that they are way too overworked and so busy that to handle the emotional piece is probably not easy for them. And I get that. But I think that we just have to look at the full picture.
Yeah.
Because it's psychologically really
hurts. It's deep. It stays with you.
Yeah.
It stays like it's an abuse.
In many ways. I mean, yeah. I mean,
it's verbal. It's like that unconscious that happens that you hold on to it like trauma, because it is traumatizing to you. And you remember a doctor that has done that to you.
Right. And so when a doctor doesn't do it, you're kind of like,
what's wrong with him? Well, what's wrong with her?
Oh, not a very good doctor. Right. That's why I said to my doctor, I was like, you have never told me to lose weight. Okay. You know what I mean? Like, that was surprising. Okay. So here we are. We're all still muddling along. We're trying to get through the best we can and get the best care we can in a time that it seems like the medical profession is just stretched even more than where they are. But if you are a medical professional listening to this, I would ask that you just take the time to look at the full picture. We're not making it up. We are in pain.
And it's not weight related all the time.
It's not weight related all the time.
Yeah.
Anyway. So we thank you for joining us for our third podcast. I did do a Facebook post asking for different topics that you'd like Cindy and I to talk about or get a little deeper in. I've had everything from makeup tutorials to trying to think of what else. Anyway, super cute. Would love to see people advocate for themselves. It's okay to interview a doctor. It's okay to say, I don't like how you're talking to me. It's okay to stand up for yourself. They're doctors, not gods.
Yeah. Yep. And it's okay to say this medicine doesn't work and persist in them listening to you and get that change if it doesn't work. Not everything is
She persisted. Yeah.
Paula, you.
All right, everyone, have a great day.
Bye. Thanks for joining us.